Hello everyone. Today I'm going to present topic poison and antidote. So this is Dr. M.K. Shukla, Associate Professor SIRTS Pharmacy, Bhopal. This topic is covered under the pharmaceutical inorganic chemistry with the code PP104. So poison word came from the French word that is poison, which means drink. So what is poison? Poison is any type of substance administered by mouth, ingestion, inhalation, skin, or which causes illness or some disease or maybe death. It also considered that acute poisoning may be accidental or suicidal or criminal. The treatment of the poison depends on the identification of ingested poison substances. So we can choose a specific antidote for particular poison. So there are various types of poisoning, and three types of poisoning considered mostly. That is intentional poisoning, which means a person or taking or giving such substances with the intention of causing harm to self or other, such as suicide or assault. And unintentional poisoning, in this case the person taking or giving such substances without knowing its side effects, like which can be accidentally. And undetermined poisoning, when the difference between intentional and unintentional is not clear. So these type of poisoning is called undetermined poisoning. uh, for example, like poison due to insecticides or pesticides. There are also some other causes of poisoning, like by heavy metals, which happen because of metallic contaminations of food and water, or leaching process, and overdose of drug and intentionally cyanide poison. There are some signs and symptoms as well of the poisoning, like reduced breath rate, muscle cramps, nausea, vomiting, diarrhea, and increase or decrease heart rate, dilation or contraction of pupil. So there is one more term, that is gas poisoning. What is gas poisoning? Common example is carbon monoxide, major hazardous for those who work in chemical industry or firefighter. Symptoms may be occurred immediately or after some times. Persons looks like in cherry red color and having difficulty in breath. So the what is the treatments? There are treatment to turn off the supply of poisonous gas, open windows to allow proper ventilation, place victim in fresh air, lose the cloth of victim, and give mouth-to-mouth respiration. Also check the pulse and give call to doctor to start medications to reduce swelling of respiratory tract of victim. So also there one more concerning topic, that is heavy metal poisonings. So what is this type of poisoning? It happens because of intake of salt of arsenic, lead, mercury, iron, or cadmium. So the toxic effect depends on content and type of heavy metals. Most deadly form of arsenic poisoning is arsenic gas. So these arsenic gas interfere with cellular respiration by combining with SH groups, thio groups of mitochondrial enzyme, and which reacts in 30 minutes. So symptoms like metallic taste with odor of garlic. Sources of arsenic gas poisoning is tobacco. Arsenic poisoning is tobacco, seafood, environmental, insecticide, skin contact like linseed oil, and drinking water. What are the symptoms of heavy metals poisoning? Like nausea, vomiting, abdominal pain, excessive salivation, diarrhea, headache, muscle paralysis, blindness, mental impairment, and sometimes kidney failure. So, what are the treatments? There are some treatment as well of metal poisoning, like laboratory test, which is also known as the tissue examinations, as arsenic deposit mainly in nails and hairs. So, blood paralysis to check. check the blood samples to which the substance is present in the serum. What are the level of serum arsenic in the serum, and urine spot test using chelating agents like EDTA, ethylene dimethyl acid, and blood level of arsenic should be not more than 50 microgram per liter. And gastric lavage also included the hemodialysis and chelation therapy to remove the arsenic, transfusion to replace loss of blood and fluid, like vitamin C by IV, root injections, and one drug that is a dimer used for as chelating agent, and analgesic to pain, remove pain is also given in this case. Cyanide poisoning so occur if inhaled fumes of hydrocyanic acid or ingestion of inorganic salt of cyanide or cyanide releasing substances like cyanamide, cyanogen chloride, peach of capricot, bitter almond, photographic chemicals, and silver polishes as well. So, potassium cyanide cause death, and it should not be more than 300 mg in the body. So, what are types of cyanide? There are two types of cyanide poisoning, that is gas form and solid form. In gas form, that is hydrogen cyanide, and in solid form, that is potassium cyanide and sodium cyanide. What are the sources of cyanides? There are many sources of cyanides like cyanide capsules, lab uses in experiments, and fumigation of ships, cyanide gas of or hydrogen cyanide. Also the sources of plant and industries manufacturing cyanides and cyanide salts, that is electroplating and gold plating of the materials, photographic and engraving, also the plastic industry and synthetic rubber industries. So, what are the clinical features? So there, the cyanide poisoning depends on the different type of doses, like two doses, small doses or large doses. So we have to identify first. In case of a small dose, like salty taste in the mouth, smell of bitter almonds in mouth and breath, signs of GI irritation, salivations, nausea, vomiting, and difficulty in breathing and cyanosis, vertigo in some cases, headache and paralysis, also confusion, drowsiness, and coma. If the large dose is taken by the patient, so they can feel the rapid loss of consciousness, twitching, convulsions, coma, death. And in some cases, very often they found death did at the scene in large doses. So the what are the treatments? So first we have to give the first aid followed by the ABC, that is airway, breath, or CPR, cardiopulmonary resuscitations. And if cyanide inhale, so give 100% oxygen, space for clear airway, and antidote. If ingested, so administer active charcoal, gastric lavage to remove all the traces of cyanide from the stomach. Antidote is given. So there are three antidotes is taking in this case, like dicobalt editate 300 mg IV. Alternative is hydroxocobalamin 5 mg IV. Also sodium thiosulfate 12.5 gram via IV is given. Sodium nitrate 300 mg IV is given. So what is antidote? Antidote are the substances that counteract the effect of poison or neutralize the effect of poison. So there are three classifications, like the physiological antidote, chemical antidote, and mechanical antidote. What are physiological antidote? They are also known as antagonist, produce effect opposite to the that of poison. Also, it used for after some traces of poison get absorbed in circulation, in blood circulation. Sodium nitrate is generally is given in this case. like if the poison from the cyanide poisoning, and atropine drug is also given. In case of chemical antidote, so it react by combining the with poison and change its chemical nature by converting poison into inactive inactive or harmless compound. Sodium sulfate is given as antidote, which convert the systemic toxic cyanide to non toxic thiocyanate. And EDTA, chelating agent, is in heavy metal poison is generally is given. Mechanical antidotes. So it act by preventing absorption of poison into body or expel out the poison by emesis or by urine. So activated charcoal is generally given in this case, which absorb the poison before absorption in the intestine wall. Also copper sulfate and magnesium sulfate is given. So what is sodium nitrate? So there's one antidote, sodium nitrate. So sodium nitrate have the chemical formula NaNO2 with molecular weight 69. It also known as ethyl nitrate. What are the properties? So the color is of the sodium nitrate is yellow or white crystalline powder. Odor is odorless. Taste saline taste, and solubility the freely soluble in water and less soluble in alcohol. So it prepared by the strongly heating sodium nitrate, and it also liberate the oxygen. What are the uses? Release mouth muscle of blood vessels. Used in cyanide poison. Used as anti-rust solution to prevent rusting of surgical instrument. Next compound is sodium thiosulfate. So it has the chemical formula Na2S2O3 with molecular weight to 48.18, also known as antichlor. Properties are it is a large transparent crystalline powder, odorless, tasteless, and practically soluble in water and insoluble in alcohol. So it is generally prepared by boiling sodium sulfide with sulfur, and also prepared by passing the sulfur dioxide into sodium sulfide solution. So the assay of this compound is it is based on a type of titration by taking 0.5 gram sample dissolved in 20 ml water. Solution is titrated against 0.05 molar iodine using starch indicator. At the end point, excess iodine react with starch turning in blue color. So it is generally used as antioxidant and used as a standard titrant in hydrometric analysis. Used as antidote in cyanide poisoning, also in iodine, lead, mercury, bismuth poisoning. Used as fixer in photographic work. Used in textile industry. Used as antichlor in bleaching process. Antichlor is a substance used to remove excess chlorine, and topically used as antifungal. The next compound is activated charcoal. So chemical formula is C carbon, and molecular weight of this compound is 12.01. It is also known as activated carbon or active coal and active coal and carbon canisters. What are the property? Like it is a fine dark grayish or blackish residue powder, odorless, tasteless, and the solubility is insoluble in water and other solvent as well. So it is prepared by burning wood in absence of air and collect the residue. So what are the uses? It is generally used as emergency antidote in many type poisoning like lead, cyanide, digitalis, snake bite, spider bite, etc. It is also used as protective and adsorbent, burning fuel, making gunpowder, disinfectant, filter toxin from blood and kidney disease, and used as used to purify blood as well. Thank you so much.